Welcome to the deep dive. Today we're tackling a really common one, knee pain, specifically patellofemoral pain syndrome, PFPS.
Yeah, that pain right at the front of the knee. Annoying stuff.
Exactly. So our mission using our revision notes is to break it down, make it super clear, especially if you're revising.
Absolutely. A clear, high-yield overview. So let's kick off. What exactly is PFPS? How do we define it?
Okay, so basically it's pain and, dysfunction right there at the front of the knee. It's about the kneecap, the patella, and how it interacts with the thigh bone, the femur.
Right. And it's super common, often linked to how the kneecap tracks, how it moves.
Yeah, and you might still hear the old term chondromalacia patellae, but PFPS is the one we generally use now.
Good point. That clarifies the terminology.
Yeah.
Okay, so
Yeah.
Causes. What brings PFPS on? Is it just one thing?
Rarely just one thing, usually a mix. I actually like the mnemonic OMABTIS. It stands for overuse muscle imbalances.
Ah, okay. Oh, normal.
Abnormal tracking, that's the kneecap movement, again, biomechanics, so how your body moves. Trauma, like a direct hit. Inflammation, and S for structural issues.
OMABTIS. That's handy. Covers quite a bit. Overuse, weak muscles, weird tracking, how you move, injuries.
Pretty much sums up the different factors,
Okay. And who's more likely to get this? Are there specific risk factors?
Definitely. Think about activities with lots of repetitive knee bending or high impact. Running, jumping, that sort of thing.
Right. Athletes, maybe?
Yeah, often. Also, muscle imbalances are huge. Weak quads, weak hips. If you've had a knee injury before, that increases your risk. And even, anatomical things like flat feet can play a part.
Interesting how things like foot posture can affect the knee.
Totally. It makes you think that, do you ever get knee pain during or after a run or a gym session? Could be a pointer towards this.
So drilling down a bit, what's actually happening inside the knee joint to cause the pain, the pathophysiology bit?
Well, it boils down to abnormal forces on that patellofemoral joint. If muscles aren't balanced or your alignment's a bit off, it puts extra stress on the cartilage behind the kneecap. That cartilage gets irritated, maybe inflamed, and boom, you get pain and problems moving.
So it's like mechanical irritation.
Exactly. Think of a bicycle wheel that's not quite aligned. It's going to wear unevenly, right? Cause friction and issues. Same idea here.
That's a good analogy. Makes sense.
Yeah.
Now, if someone comes in with that front of knee pain, what else should we be thinking about? Differentials.
Good question. You've got to rule out other things. Patellar tendinitis pain below the kneecap in the tendon.
Okay.
Chondromalacia patella, we mentioned that. Osteoarthritis, particularly in older people, could be a factor. Even a IT band syndrome, which is usually pain on the outside of the knee, sometimes gets confused.
So other knee issues can present similarly. Got it. How common is PFPS, actually? You mentioned it was common.
It really is. Estimates suggest around, 23% of people in the UK might experience it at some point.
Wow, nearly a quarter.
Yeah, and it seems to pop up more often in teenage girls and, again, people who are pretty active.
That's a significant number of people affected. Okay, clinical features. What does it typically look and feel like for the patient?
Main thing, that anterior knee pain. So around or behind the kneecap. It characteristically gets worse with bending the knee.
Like stairs.
Stairs are a classic. Running, squatting, even just sitting for a long time with your knees bent, the moviegoer sign.
Ah, right. Anything else?
You might get some swelling, sometimes a cracking or grinding feeling. That's crepitus. Maybe even a sense the knee feels a bit unstable, like it might give way.
So pain with bending, maybe some crepitus or swelling. That anterior knee pain on stairs or getting up from sitting is key, though, you'd say.
Definitely a big clue.
And how do we confirm it's PFPS? Lots of scans.
Actually, no, not usually. The diagnosis is mainly clinical, meaning based on the patient's history, what they tell you, and a physical examination, checking movement, strength, where it hurts. Imaging like X-rays or MRI isn't typically needed unless you're worried about something else, like a fracture or significant cartilage damage.
Right, so history and exam are key. Okay, management. What's the plan once PFPS is diagnosed?
The main goals are, reduce the pain, obviously, but also fix the things contributing to it, like those muscle imbalances, and improve how the knee functions overall.
And how do we do that?
It usually involves a few things. Relative rest, easing off the stuff that makes it flare up. Physical therapy is really, really important.
For strengthening and stretching.
Exactly. Working on muscle imbalances, improving biomechanics. Pain management might involve ice or simple pain relief. Modifying activities is crucial. And sometimes orthotics, like shoe inserts, can help if foot mechanics are involved.
So a multi-pronged approach, often led by physio. What's the general outlook? Prognosis.
Generally pretty good, actually. With the right management, especially that conservative stuff like physio, most people see their symptoms improve and get back to better function.
That's encouraging.
It is.
But
it can sometimes come back, so keeping up with exercises or self-care might be needed long-term for some people.
right, maintenance is key. What happens if it's just ignored or not managed properly? Any complications?
Yeah, if it becomes chronic or isn't treated, you could end up with ongoing pain that can really limit activities, affect sports participation, just general quality of life,
Makes sense. Persistent pain is debilitating.
Definitely underscores why getting it diagnosed and managed early is a good idea. Prevent those longer-term issues.
Okay, so quick summary. PFPS is that front knee pain, often from tracking issues, loads of potential causes, worse with bending, usually diagnosed by exam, and treatment focuses on physio and activity changes.
You got it. And a little memory trick. Think PFPS, patella, femoral, the location, pain, the symptom, syndrome, because it's a collection of factors.
Nice. PFPS, Patellofemoral Pain Syndrome. Simple.
So here's a final thought to leave you with, thinking about biomechanics and muscle balance for the knee. How might applying those principles more broadly actually benefit all our joints in the long run?
That's definitely food for thought. Goes beyond just the knee.
Absolutely. And remember, if you're revising for the MSRA, check out passthemsra.com and freemsra.com for more resources.
Great stuff.
Thanks for tuning in to The Deep Dive.